Let's go.
Welcome to The Integrative Edge, your go-to podcast for fresh perspectives on holistic health and functional movement. Join us as we explore innovative ways to optimize your health naturally and sustainably.
I'm Kelly Demers, founder of the Integrative Wellness Coalition and the owner of True North Performance.
I'm Lindsay Seefeld, doctor of physical therapy and owner and operator of Uplifted Oncology Rehab.
I'm Dr. Kimberly Klimek, licensed pharmacist and owner of Innate Healing and Performance.
You can find the show on Spotify, Apple Podcasts, or wherever you get your podcasts. Subscribe so you never miss an episode.
Welcome back to the Integrative Edge, your podcast where we explore innovative ways to optimize your health naturally and sustainably. I am your host, Kelly Demers, and as always, joined by my two amazing co-hosts, Dr. Lindsay Seefeld and Dr. Kim Klimek. Today's episode takes on a critical, often under-discussed topic. It's the hidden truths about birth control. And while birth control is a powerful tool for reproductive health, there are layers of impact, whether it's physical, emotional, or systemic. And many women aren't really informed about all of those things. Our goal is to bring those pieces to light and empower you with knowledge. So one of the things that we know is birth control today, especially hormonal methods of birth control like the pill, the patch, IUDs, they're commonly prescribed for everything from pregnancy prevention to irregular cycles and acne. But what's often missing from that conversation is how these interventions affect the body long term. So many women benefit from birth control. Again, they just don't always have the information that they need. So we're here today to ask some thought-provoking questions as well as provide some more complete answers. This episode dives into the physiological, emotional, and functional health dimensions that often go unaddressed in a typical doctor's office visit. So with that, knowing that we just talked about the dimensions that often go unaddressed in a typical office visit, Kim, I'm going to toss that over to you so you can talk about that.
Yeah, I really appreciate that introduction, and just to kind of put that little disclaimer out there again too, the episode here is meant to really be educational and informative, and at the end of the day, we each have to make our own personal choices and decisions and live with those, right? And so my goal usually, even with like working in my practice, is just simply to educate. And a lot of the webinars and seminars that we do is like, I actually talk a lot about birth control and synthetic hormones, because that's what birth control is, and I'll explain that in a minute, and just the impacts of that. And so it's like if you're feeling any of these types of symptoms and you have birth control, you've had birth control, or you're thinking about birth control, it's just being mindful to have that full picture so then you can make your decisions at the end of the day. So with that being said, just kind of getting into it to start with. Birth control is what I said. It's called it's a synthetic form of hormone. So it's a contraceptive, but synthetic means like a man-made chemical, okay? And so normally in like oral contraceptives, you're getting a combination of some estrogen and what's called progestin. So you're getting a combination of estrogens and progestin. Now, if you listen even to my voice, the verbiage makes all the difference. So a lot of people think they're getting progesterone from their birth control, and they're not. They're getting progestin. So progestin does not equal progesterone. So that I just wanted to kind of clear that up right off the bat, because it's very important, because they're two different chemical structures, and that makes all the difference in how your body responds to that, or your cells respond to that. And then secondly, there's an assumption that like birth control regulates your hormones. That's not also accurate as well. Like a little bit more accuracy to that would be that it actually shuts down your body's natural cycle, right? It's preventing ovulation, so it's suppressing any type of progesterone production. And again, that's done through the synthetic hormones. So when that is happening, again, I think just like from like birth, or I guess when we start menstruating, I should say, our bodies go through this natural hormonal cycle where we have our little rises in estrogen, and then the second half of our cycle, we have our rise in progesterone. And then of course in the middle, we're ovulating and you have your LH surge. So all that should generally kind of be happening in like a 28-day cycle, right? And then if you're using a synthetic hormone, it's going to kind of shut that down. But like in the essence of being a woman, like our bodies that's kind of just how we were created. We were supposed to kind of do all these things. And then when you get maybe the synthetic hormone, it shuts all that down. So then people start to feel potentially a little bit blah. And so we'll go into, like, for lack of a better word, blah, but we'll talk about, I'll just talk about a little bit some of the symptoms, but definitely one of the bigger ones is mental health for people. So I feel like I have a lot of experience working in outpatient pharmacy and then obviously my own experiences with birth control, which we'll kind of talk about that. But whenever people would come and pick up their contraceptives, it just seemed like a couple months down the road, it would almost be like they're gonna be getting like an antidepressant or something like that instantly. And then I didn't, like, when you look into this a little bit, you understand, because yes, the synthetic hormones or birth control especially can be associated with higher risks of depression and anxiety and like mood changes, especially in like teens or sensitive individuals when you're just starting out with like hormones, because it does affect our gut and the microbiome. And a large portion of our serotonin production, that kind of happy hormone, comes from your gut health. So when you're disrupting the microbiome, especially with oral birth control, it can lead to those type of mood changes and some of those symptoms for people. So, I mean, that's definitely one of the first and kind of foremost deficiencies that kind of comes along, is the depletion in the microbiome and gut health, and it can contribute to leaky gut symptoms for people, and then compromising their neurotransmitter production from the gut. The second thing is it can, I guess one of the most important things I have people be aware of is it can lead to estrogen dominance symptoms. So we all think we're getting this like little micro dose of estrogen, but again, it's the little things that add up over time. So every day we take a oral, I learned about this kind of, I guess it goes back to pharmacy school, like sort of the 101 of how I learned like pharmacology. But when we take an oral dose of a medication, so like a tablet or a capsule or something like that, it has to go through something called first pass effect in your liver. And that is, in functional medicine, I learned that's actually one of the primary sites for like metabolizing hormones and thyroid hormone production and how we process even supplements and medications. So again, when we get that little micro oral dose of estrogen, it's basically like it goes through what's called first pass effect in the liver. And even though it's like a little dose, it kind of, I tell to people, it kind of explodes in your body. So then there's actually like more estrogen. So over time, the cumulative, because we take oral birth control, you're supposed to take it every day, right? Unless you're on your like little placebo week or something. You're getting that little dose of estrogen every day. And then if people potentially have genetic mutations where they don't detoxify or eliminate some of those estrogens appropriately, plus the environmental exposures of estrogen, that's what can actually start to lead to some of their symptoms of estrogen dominance, and then the mood changes and breast tenderness. So there's actually a lot of risk of excess estrogen, and then it eventually over time it can lead to more PMS type symptoms, heavy periods, mood swings, and then for sure like breast tenderness. Of course, increases risk factors for breast cancer, cervical cancer, and I've seen that in terms of obviously numbers I've actually looked at on paper for hormone testing, and then like Dutch hormone tests and saliva hormone tests. And then the other one is depletes key nutrients in the body. So very heavily linked to vitamin B depletion and magnesium and zinc. And magnesium is responsible for like 400 functions in the body. So even at a bare minimum, I remember when I was still working in like conventional outpatient pharmacy, I kind of was aware of at least the micronutrient deficiencies. So like when I was dispensing birth control, I was like, oh, and you might want to get on like a multivitamin and something that helps you with your B vitamins because it could potentially deplete your vitamins. And that was before I even knew about all the other side effects. But I think I was still trying to be like, okay, well, I was trying to be an advocate for women's health, I think at that time even.
Can I ask a quick question? If many hormonal contraceptives deplete key nutrients, and you've mentioned B vitamins, magnesium, and zinc, how do you help clients reintroduce those? I know you had talked about a multivitamin, but is there a way to introduce that through food?
Oh yeah, I mean, definitely like you can get higher zinc containing foods, and then I give people like a little list of that, but like pumpkin seeds are really good for zinc, and oysters is one of the highest. And that's why even if you see supplements, they might be like saying it's some form of oysters because they are actually one of the highest foods in zinc. And then B vitamins, of course, you're looking at like quality sourcing of like red meats and there's some plant-based things and some nuts and things like that. Magnesium, I think it's just definitely magnesium is a low-hanging fruit in terms of supplementation because it's just really hard to get all the amounts that you need in a day from food for magnesium. But
Perfect.
And then going back a little bit into some of the risk factors, to me it's kind of a little bit ironic because there's this long package insert list of all these side effects that can come from birth control, but we never really get talked about in our doctor's office, or at least when I was 16 or whatever and going to the doctor for pregnancy prevention. We never really get told about any of these risk factors. And I definitely think if I would have, I think I would have probably taken a step back and said, maybe I want to evaluate this or look into it a little bit more. Because I've had clients say that. They're like, oh yeah, I actually never had birth control because I saw that package insert and I was like, yeah, no, I don't want anything to do with that after they left the doctor's office. But there's increased risk for blood clots and stroke. And of course, that's a higher risk too if you have genetic predispositions, and we don't get genetic testing when we're young, Right. But it's like the first thing they ask you when you go to the emergency room if you had a blood clot for a woman, for sure. It's like they're like, are you taking oral birth control? And then they would make you stop essentially right away. And then I think I had mentioned to you just I would say something that's really not discussed more is just the risk factors for actually cancer long term. And again, I don't say that to like scare people. It's just like this is information that really wasn't provided to me when I was, talking to providers about contraceptives, because we know in the functional space that low levels of progesterone increase your risk factors for having like breast cancer for sure, and then large estrogen dominance, right? Because hormone-driven cancers, and again, hormones is such a touchy subject for people because people do hear about like hormone-driven cancers, and it's all about the fine-tune the balance for sure. And I think at the end of the day, I just want people to be aware that there's very much a difference between like synthetic hormones and like your body's like natural hormones, or even like bioidentical hormones, which we talk about a lot in like my practice, but getting strong exposure to estrogen like that over time can have these consequences.
Building on hormone imbalances, how does long-term use of birth control influence hormone imbalance?
It's interesting because even when people are like kind of coming off of birth control, which we'll talk about strategies too, because I help a lot of people with that in my practice. The long term is like, you can have the synthetic hormones kind of sit on your receptor sites. I know we talked about that in a couple previous episodes, but they have to kind of bind, but they can sit on your receptor sites even for many months after you stop birth control, which can block off, again, a lot of it is just estrogen dominance, or because even if you have an IUD, you're actually getting, again, you're not getting progesterone, you're getting progestin. And people always kind of ask me that. They're like, well, what's the best form of birth control? Even a copper IUD, you're gonna displace your zinc and copper, which is a very fine balance that needs to happen in the body as well. Copper and zinc need to be balanced. So then when you have copper IUD, which is non-hormonal, it can throw off those levels in the body. So there's not really like a perfect form of birth control, but that's kind of where I'm teaching people and just having them learn more about like cycle tracking and tracking your cycle. And honestly, I always tell people like your period is a sign of your health. You should ideally have a period to help you understand maybe where you're at in your health, because if you're having like heavy clots and bleeding and those things, that's all big risk factors, right, for potential cancer down the road, I would say even, because of, to me, that screams a lot of estrogen dominance for sure. And you would want to be aware of that so that you can actually help support the root causes of it versus just masking it. So we can talk about that too, because you get...
When you had mentioned cycle literacy being kind of a cornerstone of health, how do you support women in tracking their natural rhythms and recognizing the key signs of hormonal shifts?
Yes, for sure. We call it now, I would say in the functional space, it's like the fertility awareness method, because we're very much like in a space of supporting women and honoring their body for all the things it can do. And yes, so when I'm in a visit with my client, I ask them so many questions about their menstrual cycle just to get an idea of what's going on, because there's tons of red flags if I hear somebody has like a short menstrual cycle or a long cycle, or they're having just bleeding through tampons or pads. Like those are all big red flags to me. And then of course, if they're starting to express like hormonal acne or those types of changes. But, and then if your cycles are all over the place, yes, like it's definitely a sign that something is off in terms of like full body health.
And maybe Lindsay, you can jump in on this when we talk about full body health. Detox support. You talked about some of the things that are going on in the system. Working with your natural detox pathways. How do you work with women in supporting that?
I think for sure, like your liver health, correct? Like, I think that's the big area you need to focus on in general, just any type of toxicity in your body, just to help cleanse. And I think that's probably the first place to start getting some of those hormonal things back in check.
Yep, like we call them like xenoestrogen exposure or estrogen. The first place that you really want to help is your liver, because it's going to flush out extra stored up estrogen. And of course you want to work on your gut health. But that's where I really like, even the first place I'll tell women to go is going to see lymphatic specialists or working on their liver drainage. And sometimes I'll have people do like a little liver flush, because I'm just going to purge a bunch of excess stored estrogen in the liver and the gut area. And then just consistent bowel movements and helping them start to learn how to track their cycle. But yeah.
Do women pretty typically get back on cycles? So if they're like fluctuating so much, just by doing that, they can get more of a regular period?
Coming off birth control, you mean?
Yeah.
Yeah. Yeah, for sure. That's pretty much my goal to do that with clients. And of course, they're not going to be happy if because some of the reasons as to why they go on birth control is because they're having irregular cycles. But again, we could go into that. It's they're not actually treating the root cause, right? They're putting a Band-Aid on it, because a lot of people will go on birth control for irregular menstrual cycles, for acne, which that comes back depending on what the acne is. If it's jawline acne, it's definitely hormonal related. But if it's more like acne on the forehead and cheeks, that's gut microbiome health, and we need to, which again still influences your estrogen metabolism at the end of the day. So it can still affect your menstrual cycles. There's we call it the estrobolome, so the bidirectional relationship between estrogen and your microbiome. It's definitely a real thing.
So what testing or protocols do you recommend for someone transitioning off of birth control that wants to restore balance naturally?
Yeah, I usually give them a sex steroid hormone saliva test to begin with. And I have a method to the madness too sometimes, because I think if people are a little skeptical about it, like that they don't really necessarily follow or understand what I'm saying, and they just they need to see that data on the piece of paper. Because when I show them how much estrogen dominance they have in their body, it's like, and then I do a saliva test for the most part, and then I'll show them, here's the risk factors this has on your body. And then I show them like a Dutch urine, like a metabolite breakdown of those estrogens. And depending, because we don't know, I don't necessarily I usually don't run like both of them, like a saliva and a urine metabolite, because even if they're high, I'm just going to give you all the beneficial things to help you eliminate those anyways. I'm going to assume potentially that you're maybe, you just want to reduce any risk factors in general, but somebody could be metabolizing it down something called like a 4-OH pathway. There's like 3 different ways you can metabolize estrogens, but that 4-OH one is very bad. If you get that high on the Dutch test, it's like, yep, you're getting that metabolite, which creates reactive oxygen species, which damages your cell. And then at the end of the day, a damaged cell, it leads to gene mutation.
Mutations,
Yeah.
So is it fair to say that it's dangerous to stay on birth control long term, or?
I think a lot of people, they'll just be like, oh, I was on birth control for a while, nothing kind of happened. Again, some of it is our genetic propensities to be able to metabolize or eliminate that estrogen. Again, I'm going to come back to my own personal story. I lived pretty much in my early teens struggling with endometriosis, which is, yes, my inability to eliminate excess estrogen, and then it kind of would grow outside my reproductive organs because I had so much excessive tissue that when I was menstruating, it didn't all leave the body, and it kind of retrograde goes back up into other organs and stuff like that. But I do fully believe that it stemmed from years of oral birth control right from the get-go, because I did get put on it when I was young. And then I had found out that, yes, and because if you look at a Dutch hormone test, even you can see in the way that we're supposed to metabolize estrogens, there are 2 specific genetic markers that allow us to eliminate estrogens appropriately if we have really good, if we do not have a MTHFR gene mutation or something called a COMT mutation. And of course, when I learned about functional medicine, I was like, well, why did I get endometriosis? Why did this happen to me? I had found out that I did have MTHFR gene mutation. So unlike other people, I already had I had a genetic predisposition already to not be able to eliminate estrogens. And then, of course, I was constipated all the time when I was little. So then I was not eliminating toxins. And again, that all built up over time, breast tenderness all the time. So that was just sort of like my kind of gateway into it. But then other people, like, kind of, yeah, if they're lucky, they may not have any of those gene mutations, or they may not have chemical exposures or things that like bog down their liver or gut health or things like that. And then they maybe do fine a little bit with the birth control. But I would say a lot of the women coming to me, even if they've had like an IUD, they start to complain of progesterone deficiency symptoms, fluid retention, bloating, depression, anxiety. And they don't realize that actually that IUD may be contributing to those symptoms. But, it's a conversation with them, like if they're willing and ready to kind of come off of the birth control, to try that and see where we can restore and kind of treat root causes to bring their body back into balance. And I never really force any of it. I just am providing education for people, and I never, because, they'll see on their paperwork that their progesterone's low. Because I have done that before too. Like, okay, they think they're getting progesterone, but it's actually not. It's progestin. So when you get a test back, their progesterone's in the tank. And they'll just be like, okay, can I get some progesterone? And I say, no, actually no, because those synthetic hormones, I can't guarantee that the progesterone is you're basically having 2 things kind of fight. You have an IUD that's always on your receptor site. So your progesterone's it may not be able to bind in there, whether you're taking the oral or topical or anything, because it's going to be working against a different hormone that's already binding on that receptor site. So if someone says, I'm ready to move off of birth control, what's the first step after coming off? Yeah, I actually put some parameters and things in place first, because they're very afraid. I think a lot of the time they're like, well, I had such painful periods before, and I just don't want to go back to that. But I'm learning about the negative effects of birth control, and I really want to be preventative about my health and these other things. And I want to help my, some of the symptoms we may have talked about with mood issues and imbalances. So first and foremost, I'll tell people, okay, we have to start eating. I'm going to already make sure your methylation pathway, or your ability to eliminate estrogens, gets upregulated. So I have them eat deep, dark leafy greens. So that upregulates methylation. So deep, dark leafy greens, cruciferous vegetables. The other thing is I have them start incorporating seeds. because that will bind, fiber, I guess fiber in general, fiber will bind up excess estrogen and help you eliminate it. And then I make sure they're not constipated, essentially, because I'm like, nope, we're going to go back to having those symptoms. And and then I get some things in place like, okay, we're going to get some like red raspberry leaf tea before, like I have a whole thing that I do with them. In your luteal phase, we're going to do organic red raspberry leaf tea to prevent cramping and help better with blood flow as you get into the menstrual period, because there's like cycle syncing and things like that now. But essentially, we know so much more now about actually supporting our body during the different phases. Like, you can understand why you have more energy during like your ovulation, and then like energy is very lower in the second half of your cycle. And I get all those pillars in place for them. And yes, if some of them have strong estrogen dominance history, that is where you can kind of get that progesterone right away for them, even in their first cycle when they come off of synthetic hormones.
What are some other alternatives? I'm just thinking of like birth control methods, so women, like we're trying to obviously prevent natural having, Is there, what other things do you coach your women on?
I mean, pretty much like the main one for sure is the cycle tracking, is actually having them get an app on their phone or start documenting on their calendar, or using like basal body temperature monitoring, because that's actually like the most accurate, because not everybody ovulates like right at day 14 or whatever. So that will help you identify like where you're at in your cycle. But people, there's definitely a lot of fear-based things. There is actually only kind of like that small window where you can get pregnant. So it's just, if your body is in sync and in tune, you can know where that time in your cycle is, where it's going to be obviously more riskier if you're sexually active. And I was like, I've been off birth control for many years now and have had the same partner, and I understand my body, so I'm not pregnant. And so because I understand my fertile windows and things like that. So that is the primary method I talk to them about. And again, there's no, in terms of like birth controls, there's no like optimal one where it doesn't really leave some of the side effects. I think it's just it's like pharmacology in general. When we're disrupting one system, it's generally going to have a downstream effect. That's with any medication that you're taking in general, like a prescription medication. There's always like micronutrient deficiencies. So it's just teaching them about their body. And then if something is off, that is, you should pursue it, not try to mask it or hide it. Pursue it and understand what the root cause of it is, and get to the bottom of it and treat it, because your body's fully capable of doing that if it's given the right tools, I believe.
Great.
If someone's listening and they are currently taking birth control, they're working with their provider, what should they be asking to make sure that they're maintaining optimal health and not going by the wayside?
Yeah, I think it's like even general. It's like we don't often get even like a full health picture before going into it, because I think that some of those negative side effects will hit people a little bit harder for sure if they're already struggling with like thyroid imbalances and already struggling with like anxiety or depression or those types of things. Like it can maybe make those things potentially worse. So just making sure you get like a full like body assessment too. And for me, it's like if there's already expressions of like gut disturbances and things like that, it's those things I really feel like should be at the top priority. But yeah, and asking people about like just their goals and like their reasons as to why they want to go on birth control. And I think for me, it was just like, I wish there would have been a little bit more informed consent. Sure. They say everything at the hospital is like, you do have informed consent and you sign the papers and everything. But in this topic very specifically, I have to imagine if I was sitting in the doctor's office, maybe hearing about some of all these potential side effects that are common, they're not like not common. Right. I might have second guessed like being on birth control, I think at that point.
Any final thoughts? All right. Thank you for tuning in to The Integrative Edge. We hope this episode sparked some curiosity and offered some valuable insights into an often one-sided conversation. As always, we're here to guide you with respect, compassion, and holistic tools. If you found today's episode helpful, please share it, leave us a review, and subscribe for more conversations that matter. We are on Spotify, Apple, or wherever you get your podcasts. Until next time.